Hello everyone, this is Ronnie Smith, Acting Director for the Ralph H. Johnson VA Medical Center, here with you for another video update what's been happening in our response to COVID. So the biggest news for us this week was we did have our first positive inpatient veteran. This was on our inpatient mental health unit. Fortunately, we had been slowly expanding our testing capability, and so also slowly expanding how we're using those tests. And so although the veteran was asymptomatic on admission, showed no signs, we knew he was going to a controlled unit, and so did a COVID test anyway. So when the test came back that it was positive, we were able to move the veteran quickly to an appropriate setting. We had already set up a COVID unit in direct support of an inpatient mental health positive veteran, so we had an appropriate environment to move them to. And now we've been doing testing for patients and staff on the unit as well. All tests that we've done so far have come back negative, so we're hopeful that we have controlled the spread, but we'll be continuing to do testing during the course of this week just to make sure. In other news, we had just completed testing for our entire CLC as an abundance of caution, knowing that our CLC patients are our most vulnerable patients. We've taken a lot of stances to try to protect that environment, controlling who can access that environment, limiting to no visitors on the unit to try to protect our veterans. But as an abundance of caution, we also decided to test everyone on the unit to make sure there was no one asymptomatic but still positive for that. I'm very thankful for all staff. They were very committed and volunteered to be tested as well when we asked about testing for them. Fortunately, we've gotten back over 95% of the results, and all of those have been negative as well. So once again, I want to thank all of our staff and everyone that works on that unit for everything they're doing to support our veterans and make sure they're staying safe as possible. We've all seen the sad news about some other nursing homes out in other states and the troubles that they've had, and so I'm just glad that we're doing everything we can to protect all our veterans. We did unfortunately get sad news yesterday as well. A veteran that we've been following, that's one of ours that's been in a community hospital, did pass away from COVID. It's an older veteran that did have multiple comorbidities, and so when we heard that he had tested positive and was being met, we did have some concerns about it, and so unfortunately he did pass away. It's very sad news. Our thoughts are with him and his family as they go through this. A couple of other updates for you as well. We did start our ED triage process on Friday. We tested that out, and we're going to be moving to that mode of operation. So the benefit of this is that we can triage any veterans that come up that need care outside of our ED and evaluate for the proper treatment. Another benefit is now those that need COVID testing on site, we can do that outside of the ED in a safer environment for both the person that needs to be swabbed and tested and for the staff in that open environment versus a contained room. So we're able to protect our building and offer ED treatment to those that just need normal ED treatment outside of the COVID in a safer environment. So we'll be moving forward with that each day during the course of the week. Today we also, VA as a whole has now pushed out a new tool on the Access to Care.va.gov website, where you can go and look at reports of COVID positive patients throughout the VA system. It's open access, and it's kind of the official data source that VA is using to publish what COVID positive patients they have out in the communities. And that site will be updated regularly going forward. And you can go on there and look at any time. You can see by state or VA the number of COVID tests that they have tested positive in those communities. Also, in recognition of the week, I also want to recognize all our volunteers and the lab for Lab Week. Although we've severely limited the number of volunteers we have and miss all of them dearly, we'll just take this time to thank all those volunteers that work diligently with us during our regular operations. And we'll look forward to having them back as soon as possible. And this is also Laboratory Week, and so I wanted to just tell them, all the staff in the lab, thank you so much for everything you've been doing. As COVID's our response has been changing day to day. Our lab teams have been there with us and changing with it, helping us set up with our new testing system through the. So now that we have rapid tests, thanks to their work in-house, and just the various things we've needed their help with in coordination with getting testing through MUSC and other entities, so that we can be as informed as possible to make sure we're protecting our staff and veterans, giving them the right level of care in dealing with COVID. Plus all the other tests that they do for us every day to make sure we're taking care of our veterans. So thank you very much to our lab team. This week as well, we're hearing the lifting of some restrictions for social distancing and the stay-at-home rules in our environment. But I just want to let you know to make sure to stay safe in whatever you do. That social distancing and all those efforts does make a difference. So just make sure you stay safe in whatever you do. Wash your hands and protect yourself and your family in whatever you do out there. We will continue to stay in our modified operations. We're not looking to expand our footprint of care at this time, and we'll stay in our current operations until further notice. That's all for this week, and we'll give you another update as soon as we can. Thank you.